This is our presentation on the effect of vaccines on development of autism by Marlon Romero, Natifa Victor, and Sarah People. We found the articles for this presentation by using online databases such as ProQuest and PubMed. We were able to access these through our school's library page. The searches were limited to peer-reviewed studies published within the last 10 years, and most of our articles are within the past 5 years. We used keywords such as vaccines and autism to find related articles. Our topic was selected due to increased attention brought to vaccines with the arrival of COVID-19 vaccines. The topic of vaccines causing autism has been revisited, which sparked an interest in further research. The information in this study can be used for patient education in our future, as well as education of patient families and colleagues. The question that drove our research was, in young children, how does receiving an MMR vaccine compared to not receiving an MMR vaccine affect children's development of autism within early development?
The first article that was reviewed was titled Vaccination Partner in Children After Autism Spectrum Disorder Diagnosis and Their Young Siblings. This article is from 2018, and the purpose is to investigate if children after receiving an ASD diagnosis obtain their remaining scheduled vaccine and to compare the vaccination partner of younger siblings of children with and without ASD. Framework. Theoretical framework prospective matched cohort study. Sample. Participants were children born between 1995 and 2010 and their youngest sibling born between 1997 and 2014. Measure. Data was taken from 6 integrated healthcare delivery systems across the United States who provide immunization data to the vaccine safety data link. Treatment. Children with ASD were significantly less likely to be fully vaccinated compared with children without ASD. Vaccination rates were significantly lower among children's siblings of children with ASD compared to those without. Parents who have a child with ASD were more likely to refuse at least one recommended vaccine for that child's younger sibling and to limit the number of vaccines administered during the younger sibling's first year of life. Results. Children with ASD and their youngest sibling were under vaccine compared with the general population. The result of this study suggests that children with ASD and their youngest sibling are at an increased risk of vaccine-preventable disease. The next article that was reviewed was titled The Combined Measles, Mumps, and Rubella Vaccine and the Total Number of Vaccines Are Not Associated with Development of Autism Spectrum Disorder, the first case control study in Asia. This article is from 2012, and the purpose of this article is to investigate the relationship between autism spectrum disorder and general vaccination, including MRR. Framework. A case control study with diagnosed ASD participants and voluntary from general school matched by sex and age. Sample. 189 ASD participants and 124 participants with the same age. Measure. 224 participants selected from general school were used as a control against 189 participants who were diagnosed with ASD around the same age. treatment. There were no significant relationship found for the mRNA vaccine or any other vaccine with the development of ASD. Results. The study found no convincing evidence for a relationship between ASD and the mRNA vaccine or the growing number of vaccines being given. This finding indicate no basis for avoiding vaccination out of concern of ASD.
The third article that was reviewed was titled Safety of Vaccines Used for Routine Immunization in the United States, an updated systematic review and meta-analysis, which was published in 2021. The purpose of this article was to review past studies to determine if vaccines caused any serious adverse effects, such as autism. The article were reviewing many vaccines but focused on the MMR vaccine. This was a qualitative study that used a systematic review and a meta-analysis. 2 trained reviewers independently screened citations and full-text publications that were peer-reviewed, and they used 338 studies reported in 518 publications. The key finding in this study was, for children across all studies, significance of evidence was high for no increased risk of autism following measles, mumps, and the rubella, which is MMR vaccine. This article provides insight on adverse effects of various vaccines, and it was funded by the Agency for Healthcare Research and Quality, as well as the U.S. Department of Health and Human Services. We can assume that there was no bias in this study. The fourth article that was reviewed was titled Measles, Mumps, Rubella Vaccination, and Autism. This article was published in 2019. The purpose of this study was to determine if there was an increased risk for children developing autism after receiving the MMR vaccine. This study took place in Denmark, and it was a study cohort that was separated into subgroups and was analyzed by using the survival analysis. There were 657,461 children born in Denmark from 1999 to 2010 that were studied. They had follow-ups from 1 year of age all the way until 2013. The Danish population registries were used to link information on MMR vaccination, autism diagnoses, other childhood vaccines, and sibling history of autism. The treatment was the MMR vaccine, as well as the DTaP IPV/HIB vaccination. The results of the study showed that 6,517 children were diagnosed with autism. This is a rate of about 129.7 per 100,000 people. The researchers determined that there was no increased risk for developing autism after receiving MMR vaccines.
Characteristic of study subject and interventions. For Article 1, the retrospective data was retrieved from the Vaccine Safety Data Link, which is collaborative project between Center for Disease Control and Prevention and ASI across the United States, capturing comprehensive medical and immunization data. The study includes data from 6 of those sites. The proportion of vaccinations between children with autism and those without autism was studied along with the proportion of vaccination among the younger siblings of children with and without ASD. Subjects. The population includes children born between January 1st, 1995 and September 30, 2010, and their younger sibling born between January 1st, 1997 and September 30, 2014. All children were members of an integrated healthcare delivery system with the vaccine safety data link. Article 2. Japanese case control study used diagnosed ASD participants and volunteers from general school as participants that act as the control. Vaccination history of subject was examined and 95 confidence intervals were used to determine significance. mRNA vaccination and the effect of the number of vaccine injections were investigated using a conditions multiple regressions model.
For Article 3, the subjects were various research articles that were reviewed by trained reviewers. The interventions were children receiving various vaccines with a focus on MMR vaccines. For Article 4, the subjects were children born over the span of 10 years and followed annually. The interventions were children receiving MMR vaccines.
After review all articles, we conclude that there's no link between mRNA vaccines and autism. Since this study were all peer reviewed and results were able to be replicated, we can apply the evidence found in our career. As a future nurse, we have the responsibility to always educate our patients. In this situation, we have the responsibility to educate parents about mRNA vaccines and autism. We have to inform them that there's no link between mRNA vaccines and autism, and it is important to vaccinate their children. This evidence-based research should be used by parents and guardians who are choosing not to vaccinate their children out of fear that they will later be diagnosed with autism. Parents can be safely protect their children from the risk of well-known disease and the complications that accompany them.
Here are our references, and thank you so much for watching this presentation on the development of autism following MMR vaccines.